Hello, good afternoon, Assalamu alaikum, greetings to everyone. Good morning to all the participants from the US. Thank you so much to everyone who is joining us today in our virtual panel discussion on domestic violence. So we will be discussing this topic, which is of great importance, especially after the pandemic. We will have speakers from the US as well as from Qatar. So thank you so much for joining us today. Thanks to everyone joining us on Zoom and all the viewers on Facebook. We really encourage everyone who is joining us today to share their questions at any moment, any point you would like to share a question, just write it in the chat box or in the comments on Facebook, and our presenters, panelists will answer it in writing as well as verbally. So we welcome all the questions that you have, and we would love to have it as much interactive as possible. So thank you. I am Isil Ogaili. I will be moderating this session, and we will start it and kick it off with opening remarks by Marjan Kamrani, Political Officer at US Embassy, Doha.
Thank you, Asil. Good afternoon, everyone. And thank you to our speakers, Debbie Tucker, Dr. Khalid, Mrs. Afeya, for joining the US Embassy, the Aman Center, and the Doha Family Institute for participating in this discussion today. And thank you to all the guests for participating as well. This afternoon, we're discussing how the United States and Qatar can work together to prevent the scourge of domestic violence and abuse in our societies and how best to respond as this crime arises. Today's panel discussion is unfortunately all too timely. As the COVID-19 pandemic took hold for more than 2 years, domestic violence has increased around the world. In April 2020, UN Women called the steep rise in violence against women and girls a shadow pandemic. A November 2021 publication available from UN Women reported survey data across 13 countries, indicating that 45% of women directly or indirectly faced some form of violence against them since the start of the pandemic. With that said, violence against women and girls was a problem long before the start of the pandemic. UN Women's statistics specify that even prior to the pandemic, 1 in 3 women faced violence by a partner. Also prior to the pandemic, UN Women data noted that less than 40% of women who experienced this violence sought assistance, and less than 10% who sought help went through law enforcement. So what do? How can we come together to tackle this monumental challenge of eliminating domestic violence in our countries, and how can we help victims in the meantime? Today, we will hear the perspectives of 3 panelists, 1 discussing her many years of experience on this issue in the United States, and 2 from Qatar sharing their experiences in confronting domestic violence here in Doha and Qatar. Holding this discussion is an important step, and having a candid and difficult dialogue about this issue is critical to acknowledging the existence of this violence and allows us to exchange views and best practices on how to confront it. So with that, I will now turn the discussion over to our panelists who will talk more about the questions and then we'll talk more during the question and answer session. Thank you so much. Thank you all.
Thank you so much, Marjan. Thanks a lot for this background. So we will we'll talk about the background of our panelists today. So Charles, can we have the entire slides up? Sorry. So thank you so much, Marjan. We really appreciate providing this background. So we will introduce our panelists today. So we will start with Debbie. So Deborah Tucker is the president of the board of directors of the National Center on Domestic and Sexual Violence and is an adjunct lecturer at Texas State University. Debbie has been working to end violence for decades in collaboration with multiple organizations in the US, as well as countries seeking to build prevention and intervention to create safety and well-being. And she served as the co-chair of the US Department of Defense Task Force on Domestic Violence and has co-founded and led organizations locally, regionally, and nationally. Debbie was among those who drafted the Violence Against Women Act of 1994, a significant national recognition of the need for change reauthorized just this week. Welcome, Debbie. Our next panelist is Dr. Khalid Al-Naama, the Director of Family Policy at Doha International Family Institute, or as it is referred to very commonly here, DIFI. He worked with CDC at the Ministry of Public Health, focusing on policies related to family welfare and sexual health. During his time at Qatar, he was involved in the development of the policy and procedure for crisis communication and helped set the strategic plan for the employees' technical competencies. Khalid has a postgraduate qualification in applied psychology, and he's pursuing his PhD in the field of psychology, besides some other professional training, focusing on family well-being and mental health. Our third panelist is Ms. Afeya al-Saadi, a social specialist at Aman Center, which stands for Protection Social Rehabilitation Center, with a bachelor's in arts and sciences, majoring in social work in excellence with excellence and honors. Mrs. Afeya received the Scientific Excellence Award, Golden Medal for the University Student category in 2020. She participated in several panels, discussions, conferences, and workshops about social work. We will start with Debbie providing some background about the domestic violence in the US, as well as support is provided and policies in order to end domestic violence. The floor is yours, Debbie.
Thank you. Okay, good. Good morning, everyone, or at least for me, it is morning. As I understand it, it is late in the afternoon for you. Thank you very much for taking time to be here as part of this critical discussion for all of us worldwide. As was included in the introduction, domestic violence continues to be a challenge. So where I'd like to start is, what do we know and what can we build on? We're very aware that advocacy is critical, that individuals have to have support when they have been harmed, and also to help those who are doing harm to stop. We have certain responsibilities in this movement that I'll review, and we have a level of knowledge now that we have developed over years of working hard in the United States and around the world, sharing what we know and asking for what we need. So I'm going to share several critical pieces of information. I'd also like to talk about the commitments of leadership in this work and how to successfully collaborate. So what is advocacy? Advocacy is a process that enhances the safety of victims of different forms of violence. It works to ensure that community systems respond to their needs. It primarily, too, in the last 20 years, has been challenging the persons who are using violence and asking them to stop. Ultimately, advocacy is a process that we hope will end all forms of violence against women and children. So what do women and children who have been harmed need? This is a list of the things that we have learned over time are the most critical, and I want to lift up for y'all the word hope. Many times those who are being harmed believe it will never stop, and we have to help in our communities and in our families encourage hope, because it is possible to stop the violence. So what are the responsibilities of this movement? First and foremost, we need to collaborate with those who are victims. We need to understand what they need and respond to develop what we can. We've got to build organizations that are continually learning. And we have to create what I call the 3 C's: cooperation, coordination, and collaboration. Ultimately, we can create a society and a world without violence. So I've got several things I have provided for you to look at. We may not be able to delve into them completely, and I hope that later you will go back and look at them closely and think about and talk about how the information there influences your thinking from here. The first one, we are here is a discussion about the role of those of us who are helping. And this discusses how we cannot rescue people. We cannot decide for them what they should do in their own personal circumstance. What we do need to do is help her identify all the options and help her decide for herself what will make things better in her life and in her family's life. The manifestations of violence is a way of understanding that the use of violence changes over time. It doesn't, generally speaking, start with the most horrific of behaviors, but it does start out low level often, and then over time gets worse and worse and worse. So I commend this to you as based on a tremendous amount of research, how it actually unfolds, and where we intervene can help us to avoid the worst potential outcomes for individuals. So you can see that there are 4 different categories of discussion, and I leave that to you to talk about with me and with one another later. The Centers for Disease Control and the World Health Organization has also done a tremendous amount of research over the years, and we've worked closely with them for about 12 years, defining these different levels of information about risk, pardon me, and who is at risk for using violence is critical information for us to be able to address at every level how we can create the changes to stop it. So the 5 things to say are something to say to a victim, to a person who's using violence, and to children. And I want to commend these to you because they have been demonstrated over time as to having huge influence on helping people to create change and to move towards stopping the violence. So you can see these 5 things. I'm afraid for you, I'm afraid for your children, it's going to get worse, I'm here for you. The most powerful one is you don't deserve to be abused. Helping victims understand that the abuse is not about something that they said or did. It is about a person choosing to use violence. And talking to persons who use violence can be very challenging. And we often tend to focus on working with the victims and leave out that if we don't help the person who's using violence to change, it will not stop. So beginning to speak with them and asking them to make those changes and pointing out that it is possible you will hurt somebody really badly or even kill them, and that no one has the right to hurt another person, especially a family member. Children who are living with a person who used violence, gosh, they struggle. And they need to hear from us around them that we care about them and that we feel that they cannot be held responsible or jump in the middle of things and stop it. A lot of children, particularly male children, get hurt when they try to stop the person who's using violence against their mother. And they don't intend to be in the middle of it, but they're frightened for the safety of their mother, and they feel that they need to step in and do something. So here's some thoughts about leadership in this work. It's not easy, it's complicated, it's challenging on every level, but we are making progress. And part of how we are doing that is continually challenging the process. We're looking for opportunities to grow, to improve. We're willing to experiment and take risk and learn from our mistakes as we move through this. Leaders are always interested in lifting up a better future and enlisting others to inspire a shared vision of how we're going to get where we need to go. Leaders also encourage collaboration, build trust, and ask people to step up and to help them to develop the competence that they need to engage in the work themselves. Good leaders model the way. They are always showing that we're living by the values that we promulgate, and we are celebrating together any small wins that make a difference, because everybody contributes to the efforts in any community or country in making change. So here are a few thoughts for successful collaboration. In order to do this work effectively and to be able to build, we have to define our vision and what we want to accomplish. We've got to constantly be focusing on the possibilities, to not decide in the beginning that nothing is going to work, but that everything is the way it is under the sun forever, for all time. We have to really have in ourselves an uplifting view of what will happen. We need to have a process for a plan of action. We need to figure out together what's going to work to offer support and the path for change to ending violence in our communities. And we have to learn how to work with each other, to listen and learn from each other, because everybody who gets involved has a different perspective and experience. So we want to be listening. We don't want to be unwilling to change, and we don't want to expect that we will do everything the way that we've always done it. We've got to be investigative. We've got to try different things and think about what works from what we've done and what others are doing in their communities, constantly looking for how we can do better. It's very easy sometimes to look at a particular profession, for example, and blame them for the fact that things are not working as well as they should. For us, it started in the United States, mostly with challenging law enforcement and the legal system and asking them to change. And at first, it was difficult to communicate. But over time, we began to realize these were some of our best allies, and they too hated seeing women and children being hurt, and they wanted to end it. So how can we fit together? What can we do together so that we are going to take a complex, difficult issue and behavior and create change? So finally, Margaret Mead, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. Thank you for your attention. I look forward to the discussion in a little bit and hearing from our other two presenters.
Thank you so much, Debbie. Thank you for this really background. So it will open the floor for Q&A later on. So now we will listen to Dr. Khalid Al-Naama, who will focus on financial abuse. Go ahead.
Hello, hi everyone. First of all, I would like to thank you, Debbie, for your presentation. I would like to start with this one. First of all, I would like to say it is not a victim fault at all. And this is a kind of a major public concern, and it can be considered to some extent a violation of a human rights. There are many forms of domestic abuse can manifest, but however, we have to understand also the cultural aspects of each forms of abuse. The most predominant form of abuse occurs within GCCs or Arab cultures can be considered as a emotional abuse, psychological aggression towards the victims themselves. Sometimes it's referred to intimate partner violence or gender-based violence. those victims actually remain passive in the relationship because of many aspects. Actually, we need to consider those. For example, there are a lot of studies mention that they are at a greater risk when they want to terminate the relationship with the abusers. So they might end up in femicide, what's called, as losing their life or being murdered by their husband. Other than that, there are also a couple of, I think most of the forms of domestic abuse have been increasingly observed in the community itself, in the GCC, in Arab world. I think the economic factor or the economic abuse. During the transition period now and the modern life, I think there are three categories that we have to consider when we talk about the economic abuse itself. So first of all, as per Adam, a classification of economic abuse can be categorized into three categories: economic sabotage, economic abuse, economic exploitation. And most of those tactics occurs actually just to exert the power and control over the victims themselves. They don't want to give them the freedom to be responsible for their financial life, where actually those kind of work in a negative way to prevent them from seeking help from professionals or even to end up this abusive relationship. There are a lot of factors can be considered also because they want to be kept or trapped in this abusive relationship, since there is a strong financial ties with the abuser themselves. Sometimes they would prefer to push their wife or their partners to quit their job because they want them to be dependent on them financially. And the cost of living is so expensive. The other factor from the economic abuse itself, it can be considered like a what we call it post-divorce maintenance, which actually occurs in terms of, what we call it nafaqa, or financial maintenance after divorce, which actually women are entitled to get those amount of monies, even to raise their kids or to nurture them in a healthy way. Probably the least form of abuse, I think here I'm speaking of Qatar, I think physical abuse. And we have done a study, I think we have done a study and we have a good indicators about the physical abuses, almost like physical abuses occur here within Qatar within acceptable range, or it can be a kind of replicating itself by other studies here within GCC itself. So what we think is the best way just to prevent those victims from being victimized by the IPV is to increase the awareness level and to educate them about their rights and how they can prevent such abusive action from occur. The issue with that is that can be considered hard to some extent. The Arabic nature of the family is quite different. We have to understand that one. We have to acknowledge their concern. They prefer to keep everything in private, and they don't want to disclose their personal information, especially those are going to affect their personal image and social image in front of their peers, family members, and so on. So I think we have to focus on educating people about their personal rights, what's right and wrong in the relationship itself. We know something actually from psychology, what we call it is a tacit agreement between husband and wife. And the traditional gender role, which exists in the families in Arabs, it's quite different, where those values are supported by the culture itself. And sometimes women, they try to challenge their husband, but they don't know this type of heated argument can end up in challenging indirectly the manhood of the husband itself. So I guess all of these factors has to be considered to some extent. Also, I would like to take you to the other part of my presentation, or what comes to my mind is the risk factors. Well, there are many risk factors has been presented in literatures and have been widely studied by scholars. It's vary across the cultures, but most likely on the individual level, risk factors are age and education and employment status. However, the employment status in Qatar doesn't have this much of effect for increasing the risk factors, since the nature of the families are quite different, because even when women get married, still her parents support her financially. And that's what we call the concept of the extended families. The educational level is actually one of the most risk factors proven to be increasing the likelihood of being abused or victimized. The philosophy or the rationale behind that is actually we need to understand what we call it, sometimes it's called male dominant nature or male dominant societies. It's been actually changed in Qatar, but because actually we have a lot of people, they have a they have higher education qualification, and actually most of them, they are well educated, so we don't have these issues. But however, we have a kind of a group, they are still conservative. And so when the argument is happening between a husband and wife, and both of them, they come from different backgrounds, some of them, they are actually more liberals and the other are more conservative. Here we can expect a huge amount of tension within this relationship, which can end up in any form of violence. I guess emotional violence is the most predominant factor which occur in GCC countries. The number of children doesn't have an effect here in the society itself, although there is a quite implication from the financial aspects. But however, the government, the Qatar government, taking care of those, especially the education allows, the health insurance, and so on. A type of marriages, this is actually one of the most important factors we need to consider from the Arabic culture. Most likely we came from actually arranged marriage or traditional marriage or consanguineous marriages. Love marriage still is not well appreciated. It has some implication within the families. It doesn't mean that they don't suffer actually from domestic abuse, but I think they are far more likely to be victimized by IPV, because actually they cannot go back to their families and seek for help, because at the beginning the families or the Arabic families tend to not appreciate the love marriages, because they prefer to choose the right person for their families, although this has been changed recently. The other thing is that when women set a high expectation in the marital life, I think the argument is increased substantially, especially if the husband comes from a very conservative family. All of these factors has to be understood well before we find a solution or we offer some help for those victims. We need to utilize a multi-layers approach to understand this complex or this situation, which actually is very complicated. When we talk about the economic abuse, when we speak with the victims themselves, we find the economic abuse is quite different from the version itself, from the economic abuse which has been presented by Adam argument and his theory. Actually, in Arabic culture, so we as husbands, we are the main breadwinner, and we have actually to support our family financially, and we have to grant them everything that they need. But what's being done actually which can be considered as a form of abuse is usually husbands tend to pay a meager amount of money to their wife just to exert the power and control. And sometimes they some of the husbands actually prefer to have a kind of commingle bank account or joint account, actually just to control all the financial transaction. So I guess those is not well understood in our culture, because actually most of victims, they don't understand there is a terms exist in literature which called economic abuse. So I guess we have to increase the awareness level in order to prevent people from getting or being victimized. I always prefer to say everyone can be a victim of domestic abuse, either children or wife, senior members of the community, domestic workers, anyone can be a victim, because that's a human nature. Everyone should have the full rights, the capacity to do whatever they want, and they have to express their point of view. no matter what are the consequences. But on the other aspect, we have to understand there are serious consequences of domestic abuse on mental health and family well-being. Regardless the divorce rate, but I'm talking actually about the depression rate and the anxiety level and PTSD, what we call this post-traumatic stress disorders. Those are most likely to be associated with victims of domestic abuse. So I guess even when the abuse or terminated for some reason, still those victims need to be entered in a rehabilitation program, just to feel that they are safe and well protected. And also, I think we have to enforce this point of view, just to have a rehabilitation program also for the perpetrator themselves. I think try to form a kind of policy that could be one of the solution. But as you mentioned, DB, we have to have like a proper advocacy plan to raise the awareness level in the community itself. People in Arabic culture tend to be very conservative. So what they used to do is they prefer actually not to seek help from the professionals. They don't want to have an outsiders. Sometimes they are so scared actually this situation might get worse, even might be end up in divorce. So they prefer to keep everything in private. Barely they speak up and they talk to some professionals, but most likely they speak either with the religious people or with their close family members or relatives. So I think, being remain passive in the relationship will send indirect message to the abuser that they can continue to abuse the victims themselves. So I don't want to take much time, but I would like to say that if we work together as individuals on individuals level or with the corporate levels to find out adequate practice that could be implemented. For example, we need to have like a proper reporting system, accurate reporting system for cases of domestic abuse. And we have to have a kind of educational program that can acknowledge the concern from the Arabic aspects or the culture itself. We don't want to stigmatize those people, even the perpetrators. And we need also to educate the violent husband or those who shows violence in their relationship about the nature of the abuse and the consequences that they can cause to their partner. And the last thing, I think we have to have like allow to criminalize any act of violence against vulnerable group, not only women. So I guess I think I've received a question from Fatima regarding the what's the role of the social work. I guess social work probably they will. I think they have a better chance from everyone else by educating, the societies and the communities about the nature of human beings and the difference between husband and wife, especially the traditional gender role. Because there is a misunderstanding of traditional gender role. Traditional gender role has to comes from cultural values and would shape our relationship with our parents or with our family members, where we need to protect others, not to cause them harm. So I guess probably we need to work more with the society themselves, with influencers, social media influencers, with the media channels. And we need to approach communities. We need to speak up. We need to talk to them more oftenly. And we need to bring like, what they call it, successful stories of rehabilitation, or even to show them that there are heated arguments. But if it's following certain aspects or certain path, they can actually come back to the track. They can still stay together after the rehabilitation program itself. So I guess all of these things, if can be implemented, will help us actually to reduce the amount of violence occur in the private rooms, or where it occurs actually in locked doors. Usually it occurs in their homes, so they don't feel safe. They don't feel safe anymore. And probably we need actually we need to understand why people justify sometimes the violence itself. Why does it occur? Well, and I think the justification will encourage to some extent the husband or partner itself to become much more violent. I think we need to stop them. We need to talk to them. but we need to understand why it's occurred at the beginning. And that's it from my end. The floor all yours. Thank you very much.
Thank you so much, Khalid, for providing all the background about what's going on and type of domestic violence in Arab countries and in the Gulf, in Qatar, and specifically. And thanks for pointing out the cultural challenges and factors that are affecting those cases, and how it is viewed from the community, as well as the needs and ways in order to help support victims, as well as stop domestic violence, and look at all of those components altogether and the role of the community and media influences. So thank you so much. We have lots of questions that are related to this, and for anyone who is interested, and all the questions that were raised in the chat box, we will address them in the Q&A. Now we are going to listen to our third panelist, so Ms. Afeya al-Saadi. So the floor is yours, Ms. Afeya. Go ahead, please.
مساء الخير جميعا بتوقيت الدوحة، صباح الخير بتوقيت الولايات المتحدة. اسمحوا لي أن أتناول المحور الثالث، وهو العنف الأسري من المنظور القطري، متمثلة في تجربة مركز أمان. خليني بس أشارك معاكم الشاشة. أتناول معلومات أساسية عن المركز. مركز أمان قامت صاحبة السمو الشيخة موزة بنت ناصر المسند حفظها الله في غضون عام 2002 بتأسيس مركز الحماية والتأهيل الاجتماعي أمان، وذلك بهدف توفير الخدمات للفئات المستهدفة من ضحايا العنف والتصدع الأسري من الأطفال والنساء والمعرضات لذلك، وفق معايير محددة لكل فئة في مجالات الحماية الاجتماعية والتأهيل وإعادة التأهيل الاجتماعي والتوعية والتثقيف وإعادة الدمج. يعمل المركز اعتباره من 2013 تقريبا تحت مظلة قطر، المؤسسة القطرية للعمل الاجتماعي، ويعنى مركز أمان بحماية وتأهيل ضحايا العنف والتصدع الأسري تحديدا من النساء والأطفال وإعادة دمجهم في المجتمع. لنا رؤية المركز متمثلة في منظمة رائدة لتعزيز الحماية والتأهيل الاجتماعي، لنا رسالة كذلك منها نشر الوعي والتثقيف لتعزيز الحماية والتأهيل للحد من العنف والتصدع الأسري. لنا أهداف تخدم الرسالة بالتأكيد، منها رفع الوعي والتثقيف، تعزيز الحماية والتأهيل، بناء وتطوير القدرات المؤسسية. الفئات المستهدفة مثل ما ذكرنا سابقا النساء والأطفال المعرضين للعنف والتصدع الأسري والتحرش الجنسي. خدماتنا تقدم مجانية لجميع من هو على أرض هذه البلد الطيبة، وننوه أن خدماتنا لم تتوقف في ظل جائحة كورونا، بل تم ملائمة هذه الخدمات بحيث أن تكون سهولة الوصول في إدارة الحماية، وكذلك الجلسات هي كانت أونلاين عبر برامج زوم وغيرها. فكانت هناك فروق في بداية الجائحة الاستمرارية تقديم وتحديات، ولكن الخدمات والاستشارات كانت مستمرة على مدار 24 ساعة. ندخل عند الخدمات المقدمة في المركز، خدمات توعوية من خلال تنظيم ورش وبرامج، خدمات وصول متمثلة في المقر الرئيسي والفروع الخارجية مثل مركز العاصمة اللي هي الجهات الأمنية، مستشفيات مثل طوار مستشفى حمد، مستشفى الوكرة، وأيضا من 30 عبر قنوات وصول أخرى، إما بالاتصال على الخط الساخن 919 أو الحضور الشخصي في المركز. خدمات حماية أيضا نوفرها هنا من خلال تمكين وتقديم استشارات نفسية واجتماعية وقانونية، خدمات تأهيلية متمثلة في جلسات وزيارات تأهيلية ورعاية داخلية اللي هي اللواء الداخلي، وخدمات الدمج الاجتماعي ويتم دمج الفئة المستهدفة في أسرهم ومجتمعهم، وتقديم الرعاية اللاحقة والمستمرة لضمان عدم انتكاس هذه الحالات في المستقبل. لدينا سياسات نتبعها، نبدأ من سياسة حقوق ومسؤوليات الحالة، ننتقل إلى سياسة سرية المعلومات الخاصة بالحالة، سياسة تنظيم الاجتماعات هي سياسة الفريق العلاجي، سياسة التوثيق وهي ضرورية كذلك في حال عادت إلينا حالة في فترات لاحقة، حتى يكون عندنا نبني على أساسها دراسة الحالة، سياسة الخطة العلاجية، سياسة الزيارات الميدانية لمقدمي الخدمة، سياسة إعداد تقارير خاصة بالحالات في حالة تخاطب مع جهات أخرى في الدولة. لدينا إجراءات كذلك، إجراءات الاستقبال والدخول، إجراءات وقواعد صرف الأدوية، وهي تحديدا تكون في الرعاية الداخلية أو دار الإيواء الشامل، إجراءات استلام حالة من المستشفى أو من مراكز أمنية، إجراءات الرعاية اللاحقة، ومتابعة الحالات وإعادة دمجهم بالمجتمع. أذكر هنا موضوع الخط الساخن 919، وهو يعمل يوميا على مدار 24 ساعة وبعدة لغات. دار الأمان تبع ذكره ويتبع إدارة التأهيل، يكون مؤقت حسب كل حالة، ويقوم بدراسة وتقييم الحالات بشكل فردي من قبل فريق متعدد التخصصات، ويتكون من اجتماعي وطبيب نفسي وأخصائي نفسي وأخصائي قانوني للدخول الإيواء وضمان استيفاء جميع الخدمات اللازمة للحالات المركبة، ومن ثم توضع خطة تأهيلية وعلاجية حسب كل مستفيد من خدمات المركز. لدينا تطبيقات إلكترونية مثل تطبيق ساعدني متخصص للأطفال بهدف الحماية، حيث نتوقع أن يعني يساعد هذا التطبيق في مساعدة الأطفال عن الإبلاغ عن أي إساءة قد يتعرض لها، سواء عنف بأنواعه ودرجاته أو تحرش جنسي. تطبيق شاوريني، وهو تطبيق متخصص للنساء والفتيات بهدف الحماية، أيضا يقوم بتقديم استشارة اجتماعية قانونية نفسية في ظل سرية. نراعي هنا ثقافة المجتمع، قد تكون الحالة تحتاج فقط إلى استشارة فقط وليس تدخل. خلينا نروح على السلايد الثاني. العنف الأسري هو أحد الأمور التي نتعامل فيها في المركز. العنف بأنواعه، بمعزل عن الفئات الأخرى، نتكلم عن أن العنف الأسري يعرف لدينا في المركز بكل بساطة أنه أي شكل من أشكال الإساءة أو سوء المعاملة أو الإهمال الذي يتعرض له الطفل أو البالغ من أحد أفراد الأسرة، وتشمل جميع أفراد الأسرة التي تقع في إطار الأسرة نفسها، أو قد يكون الأسرة لا تسكن في نفس المنزل، ولكن قد أيضا يتعرض لأحد أفرادها بعنف معين في الحالات المركبة، ويكون هذا العنف من قبل أحد أفرادها بما له من سلطة أو ولاية أو علاقة بالضحية. العنف هو سلوك ونمط منهجي للمسيء داخل علاقة تتميز بالحميمية في معظم الأحيان، التبعية في أحيان أخرى، أحيانا حميمية وتبعية وتكون مزدوجة طبعا، وفي الغالب تكون هذه العلاقة علاقة ثقة بغرض اكتساب السيطرة أو الترويع أو الاستغلال. نصنف العنف أو أنواع العنف لدينا في المركز بكل بساطة تطرق إليها الزملاء السابقون ديبي والدكتور خالد، عن أنه هناك عنف نفسي بدرجاته، وعنف جسدي متمثل أيضا في عدة صور. خلينا بس أروح للسلايد اللي بعده. نتطرق إلى أسباب العنف، أسباب اجتماعية واقتصادية، وهناك أسباب سلوكية وأسباب نفسية. الأسباب الاجتماعية والأسباب الاقتصادية يمكن حصرها ببساطة في الخلافات الأسرية، بطالة والفقر وما إلى ذلك. ممكن يكون بعد من ضمن الأسباب السلوكية انحرافات السلوكية، والاضطرابات النفسية هي الاضطرابات الشخصية بالذات. ممكن نتكلم عن آثار العنف الأسري من منظورنا يكون على 3 مستويات: على المستوى الفردي، المستوى الأسري، ومستوى المجتمع. فيما يخص آثار العنف الأسري على الفرد، قد يتعرض الفرد بسبب العنف الواقع عليه بأنواعه إلى التشرد أو الإدمان أو انحرافات سلوكية خطيرة تؤثر بالتالي على تماسك الأسرة. فهنا ننتقل للمستوى الآخر من تأثير العنف على الأسرة، قد يصاحبها تفكك، تصدع وتشتت أسري. ننتقل بعدها إلى المستوى الذي سيتأثر بطبيعة الحال اللي هو مستوى المجتمع. يتأثر المجتمع أيضا، ستكون هناك نسبة من انتشار الجريمة وتخلف مجتمعي واضح. ندخل الآن إلى صلب الموضوع اللي هي مقاربة مركز أمان في مكافحة العنف الأسري. مقاربة مركز أمان تكون عبر 3 خدمات تطرقنا إليها سابقا، اللي هي خدمات توعوية، خدمات حماية، وخدمات التأهيل. إذا تناولنا خدمات التوعوية نستطيع أن نحصرها مبدئيا في تصميم برامج توعوية وتنفيذ هذه البرامج من خلال أنشطة، ومخرجات هذه المقاربة يكون بمجتمع واعي بمخاطر العنف الأسري. خدمات الحماية نركز على رفع مهارة التشخيص لدى مقدمي الخدمات، سواء من الأخصائيين النفسيين أو الاجتماعيين أو القانونيين، ومن ثم يؤدي ذلك إلى تفعيل الجلسات الإرشادية بما لها من أثر إيجابي في الوصول إلى قدرة عالية على الوصول للضحايا لخدمات المركز. المستوى الأخير من تقديم الحماية، خلينا نقول خدمات تأهيلية، ونركز على خدمة إدارة، نقدم جلسات في إدارة الغضب، وهي معنية بالشخص المرتكب العنف، وأيضا هناك آثار ما بعد الصدمة، وهي متخصصة أيضا نقول لضحايا العنف. أقدر بس أقول أنها المخرج من هذه المقاربة يكون حالات مؤهلة ومندمجة بالمجتمع، وهي الخدمة الأخيرة التي ممكن ندمجها في خدمات التأهيل، الرعاية اللاحقة ومتابعة الحالات وتمكينهم، بحيث نضمن عدم يعني أن يكون مآل الحالة مآل حالات نجاح وعدم عودتها إلينا بانتكاسة. أكون هنا تقريبا شملت ما كنت أذهب إليه اليوم. شاكرة لكم، وأنتقل للأخت أسيل. شكرا أسيل.
Thank you so much, Ms. Afeya. Thank you so much for this really great background about Aman as a support center here in Qatar, and maybe lots of people are not aware of these services. So thank you so much. So now we will open the floor for questions. Go ahead. Go ahead, please.
اسمحي لي أجاوب على السؤال اللي موجود على السكرين. أستاذة عافية، المركز أمان يوفر برامج تعليمية لطلاب المدارس. نعم، هناك برامج متخصصة تقدمها إدارة التوعية. نوعي الأطفال بالإبلاغ عن حالات العنف، بتوعيتهم بمخاطر التحرش الجنسي، ولدينا حملات تلف جميع مدارس قطر على جميع المستويات. هي حملات لا تلمسني، يقوم بها متخصصون لتوعية الأطفال من سن KG1 و KG2 وانتقالا للثانوية، ونغير طبعا مسمى الورشة بحسب ما يتناسب مع الفئة العمرية.
Thank you so much, Ms. Afeya. Thank you. Thanks a lot. So we really encourage everyone to share their questions again in the chat box or in the comments on Facebook. We have a number of questions also in the registration report. We have lots of questions. So, and you already started, Ms. Afeya, with answering the last question that we got, which is directed to you about the center. So, some of the many, so please feel free to chime in, to jump in whenever you would like to answer the questions. One of the questions is related to part of the presentation that was made by Debbie, which is what type of language is used to talk to victims, victims of domestic violence, to children who are in a family that has some type of domestic violence, as well as to perpetrators. So you focused on the different languages. So how can the victims be addressed in such a way so that it doesn't, the discussion and the chat with them doesn't form and doesn't make any type of pressure on them, because they might feel that they're oppressed because they have the children, they are oppressed because of like the social concerns, the cultural concerns. So how do you approach them and how do you talk to them?
It's a very good question. It is difficult to approach someone that you're scared for and that you know is hesitant to reveal difficulties within the family. That is a consistent issue for everyone. And what we've learned is that and the 5 things to say that I offered comes from years of research about what made the most difference to a victim, to a person using violence, or to a child in feeling that they were being supported, respected, and that there was care for them, to move out of a place of danger and constant struggle to a place of safety and well-being. And that can be done without necessarily breaking apart the family. There was a misnomer or a misunderstanding in the beginning of our work 40 years ago that our goal was to break up families, to ask that anybody who had used violence absolutely not be in contact with members of the family. That was not what we wanted. What we wanted was to stop the violence, to help people learn how to have a relationship that was respectful, supportive, and not one person telling everybody else what to do, but instead working towards building a family where everyone had an opinion, a say, but decisions were made with everyone's interest at heart. I hope that's helpful.
Thank you so much. Khalid and Afeya, would you like to comment on this question? Do you have any input?
Yeah. I would like to say something. I think Debbie has mentioned something really important for everyone. I think the decision-making process and the Arabic families has to be revisited again. We need to educate them that it shouldn't be like a part of someone who should dominate the rest of the families, and instead they have to work together actually to achieve their target or their goal. And to be honest, that's so confusing, because that's what we brought up. But now and recently what we've seen, people, it seems to me that they are educated, but their parents start to dominate the rest of the families, even though they are educated. It seems to me that they are so scared to lose the control over the family members, so they try to oppress them, to keep them silent. So I guess we need to encourage them to speak up and to talk to each other, and to solve their own issues. Just they need to have a normal dialogue between the family members. That could solve a lot of issues, as Debbie mentioned.
So our idea is to involve all the members of the family, even in those sensitive issues, even when there is this domestic violence and there is this gap between the members of the family, the dad and the mom. And so the kids should be involved, and all the members, they should contribute and they provide their feedback. True,
yes,
I totally agree with you in Arab countries. Yeah, and yeah, just like be frank with them, listen to them, and to involve them in the discussion. Ms. Afeya, do you like to add something? Great. Okay, thank you. Some other questions are related to, like, if there is a victim of domestic violence, so what should they do? How would they report it? Whom should they approach? And what type of support they will get? So how does it differ between the US and Qatar or Arab countries?
Well, I thought the best one to answer this question is Afeya, but I think because they are the most they are actually the service providers who provide the rehabilitation program, the shelters for the victims themselves. But basically, I think that from my point of view, I think that should be started from the school itself. Especially if we talk about kids, they should approach, the social workers, psychologists, and let them know that there is something unacceptable going on in the home. So that's the first case for the children, from my point of view. The other thing is that I thought they probably could, consult someone over phone, and instead of just going and visit a service provider here in Qatar, and they are afraid to be stigmatized, or even they might be known, because we are living in a very small country. So I guess this is one of the tactics that could be very useful for the victims, actually, to ask for help over the phone. just to consult with someone instead of just forming an official case to the authorities or even to approach, Aman. The floor all is yours. I think maybe Afeya would like to add something.
حابة أضيف طبعاً أن إحنا قنوات الوصول في مركز أمان إما بالحضور الشخصي مباشرة ويتم استقبالها بسرية تامة وأخذ بياناتها ومن ثم تحويل الموضوع تدرج لنا إجراءات معينة وبروتوكول معين. عندنا قنوات وصول عبر الخط الساخن 919 ويتم الاتصال بالحالات اما ان يكون الشخص نفسه هو اللي يتعرض للعنف او مبلغ يعطينا بيانات ومن ثم نقوم بالتواصل ومتابعه حاله العنف المنزلي. لدينا كذلك تحويل قد ياتينا من مراكز امنيه، قد يكون من مراكز طوارئ مستشفيات حمد وغيرها، تاتينا ايضا من عبر المدارس بالاتصال مع وزارة التربية والتعليم وقسم الإرشاد الطلابي. في آليات بروتوكول شراكة مجتمعية كاملة بهالخصوص، في وعي كامل من جميع مؤسسات الدولة بهذا الخصوص. فهذه قنوات الوصول اللي أقدر أذكرها لك، ما أخفيك إن في بلاغات كثيرة تكون عن طريق مراكز الشرطة. يتم حل الموضوع على حسب درجة العنف نفسه. أحياناً إذا كان تهديد مباشر لشخص لحياة الشخص طبعاً يتم توجيهه من قبل الخط الساخن بالتوجه للجهات الأمنية، لأن إحنا مركز عمل اجتماعي جهة توثيقية ولسنا جهة شرطية. مركز الاتصال عندنا ورقم 919 وموظفين الخط الساخن عندهم اتصال مباشر بالاتصال الحكومي. فيعني أقدر أقول إن عندنا سرعة وصول كبيرة وآمنة للجميع، وهذا اللي أقدر أضيفه في الموضوع. شكرا.
Debbie, so you shared thank you so much. Thanks, Afeya. And so Debbie, so you shared some notes in the chat about being proud of initiating the hotline, which is 24/7.
Yes, ma'am. That was a huge effort to actually create a free 1-800 number is what we call it, a way to call from anywhere in the United States. And one of the most wonderful things I got to do was to fly to Guam when we finally were able to add Guam to our system so that all of the parts of the United States could access information and support. And it is anonymous. A person does not have to say who they are or where they're calling from, but they can lay out what they've experienced and what their worries are. And we can talk with them about what has happened, what kinds of fears and worries they have, and what steps they think might be helpful, and provide a lot of information about what is available in their community. You know, all across the country, there are programs started in the community to provide assistance. And then there is also like the law enforcement role, the role of religious leaders, the schools, you know, community groups of other sorts that may be willing to help. There's a whole range of opportunities for assistance. And we keep learning how to build stronger partnerships, looking at ways that we can bring, for example, the big challenge now is how can we bring more groups that men belong to, social clubs or sports teams or different leaders that people look up to that will speak out and talk about the need to end the use of violence. And that's a big push right now for us, is can we have allies in various parts of the culture that can help to say, yes, this is what we used to do, but we are moving to a place where everyone within a family is respected and supported.
Thank you. Thank you so much, Debbie. So the first step for anyone who is suffering from domestic violence is not to go immediately like to the police. Is this that you all agree on? And like sometimes people get confused because there are different types of abuse and violence. So as it was discussed earlier in the panel discussion, so there is emotional type of abuse, there is financial abuse, there is physical abuse. So at what stage do you advise that the victims step up and talk about it? Or even seek consultation, as you all agreed. So the first step is to seek consultation. And it is a bit difficult in our communities, as Khalid noted. But at what stage that they need support, they should seek support? What do you think?
I don't know who should answer this question. Shall I start, or Debbie, you want to go first?
Please.
Yeah,
go
okay. Well, I guess, you know, if someone, I think there is like a serious issues going on with his life, and you think this is like a constant issue, as mentioned by DIFI previously, I think that should be notified to the authorities or whomever is responsible in this area or region. What we've been raised by one of the well-known author or researchers called Campbell. She is from the United States. And I think we have to take, you know, all the domestic abuse, you know, reports seriously, because it has to move on or to go on a well and systematic process for assessing the nature of domestic abuse itself, to measure if there is like a risk of homicide, for example. And that's why I think she came up with one of the tools called danger assessment tool to assess the level of risk involved in this relationship. So for example, if you receive a phone call and the victims just said, we have an ongoing heated argument, it's quite different from someone who said, well, actually, I'm being continuously physically abused by my husband, but the receiver of that phone call, he or she should ask, well, if your husband has a weapon or something. So the nature of abuse and the consequences of the damage is quite different. So I think we have to have like a proper diagnostic tool in order just to understand which protocol we have to activate once we listen to the victims while they are calling us, as social workers, as doctors, or as medical health providers. That's it.
Thank you. Thank you, Khalid. So, Ms. Afeya, since you work closely with victims of domestic violence here, so what's the first step that you think should be? Or what do you do with them? What do you tell them?
بما يخص ضحايا العنف، عندما يكون بالغ وواعي لما يحدث حوله، نحن نعول على هذا الوعي في أن يعني بما أنه وصل إلينا أوريدي واعي أن عنده مشكلة، فهذا يسهل علينا حتى أن احنا نقدم له الخدمة. لكن احنا لازم نشتغل على أنه ما يرجع يتراجع، يسحب الشكوى أو لاعتبارات أسرية أو ما إلى ذلك، أنه يرجع تتراجع في كلامها أو تخاف أو يجيها تهديد معين. نشجعها على أنها تكمل معنا، لأن في مؤشرات تدل على أن هذا الشخص أو شريك حياتها أو أي الشخص المرتكب العنف مثل ما قلنا هو نمط سلوكي موجود في الأسرة. في عوامل مثل ما قلنا السيطرة، ممكن تكون عوامل اقتصادية، ممكن يكون طريقة تنشئة معينة، فكر معين، مفاهيم معينة، ما زلنا احنا نحاول ان احنا نغير فيها بشكل إيجابي. فدائما نتمسك بالحالة. أحيانا تتصل بالاتصال الأول، عندما نرجع نتصل الاتصال الثاني تريد غلق الملف أو سحب الشكوى، نشجع على الاستمرار، نطمئنها، نشرح لها آلية العمل، السرية، طريقة إقناع الطرف الآخر بحيث أنه يكون يعني وقع هذا التدخل آمن على جميع الأطراف، حتى يعني نضمن عدم تفاقم العنف عليها. عندما يكون طفل نتبع نفس الأساليب، ولكن عندما يكون مبلغ مثلا عن طفل وتأتي الأم تسحب الشكوى أو الأب، هنا لا نغلق الشكوى بل نستمر، لأن الطفل في الآخر هو تحت السن القانوني، ومن حقنا أن إحنا كمركز بما أنه وصل لنا أن في طفل معنف أو متعرض لأي شكل من أشكال العنف، نجد عندنا إجراءات في إدارة الحماية متمثلة في قسم الدعم والاستشارات القانونية، يرغم الوالدين أو من يقوم برعاية الأطفال بإحضارهم للتقييم. أحيانا عندنا فريق طوارئ يطلع من كل المدارس إذا كان البلاغ من المدرسة، يقيم الأطفال في حال كان المبلغ يقول أن الطفل عليه آثار واضحة للعنف. يعني هي بشكل ما تقولين نتأكد 100% من الشكوى، لا نأخذ أي شكوى على أنها إلا على محمل الجد، لأن أحيانا كثيرة تكون الشكوى في مظهرها شكوى عادية، ولكن قد تكون على مثل ما نقول رأس اللي هو الجليد فوق وتحتها المشكلة تكون متشعبة وكبيرة، والعكس صحيح. يعني إحنا من ضمن التحديات اللي نواجهها البلاغات الكاذبة أو الكيدية. أقدر أقول لك إن إحنا نسبة كبيرة من الحالات أو البلاغات اللي جينا وطلب الخدمة يكون مشاكل أسرية، والدكتور خالد يعني أتوقع يأيدني في هالموضوع، عندما بالذات في مشاكل ما بعد الطلاق أو أثناء فترة الطلاق، بحيث أن كل طرف يحاول يحصل على مكاسب مادية أو نقول حضانة وما إلى ذلك، وهالأمور اللي متعلقة بالطلاق. فمعظم الأحيان يكون البلاغ كيدي، يكون بلاغ كاذب، ولكن أيضا إحنا لازم نتحقق منه ونكمل الإجراءات للآخر، ونعطي توصيات بتحويلهم لمراكز استشارات أسرية. وعندنا إجراءات تلزم أولياء الأمور بعدم إقحام الأطفال في خلافات الأسرية وخلافات الطلاق وما بعد الطلاق وما إلى ذلك. أتمنى أكون جاوبت على يعني سؤالك أستاذة أسيل.
Thank you, Afeya. Debbie, would you like to comment on what is the process in the US? Is it the same? Is it different? What mechanisms do you have to evaluate those complaints?
Sorry, I couldn't figure out how to unmute for a second. I think that those challenges are individual decisions. You have to sit with a person who is asking for help and can help them look at the whole picture of what might make things better. It took us a while in doing a lot of engagement with the law enforcement and criminal system to help them to see that there were ways to step in without necessarily destroying someone's whole life, but instead to confront that the use of violence has been defined as a criminal act, and that they have an opportunity to use this moment where the authorities have become aware of their behavior to make change. And that is why we started what we call battering, intervention, and prevention programs. And those programs are both voluntary or referred by the system. And in many communities now, we have a family violence judge. So that person who is deeply involved in this, all of these issues, will hear those cases and ask that rather than sending the person to jail or rather than fining them a huge amount of money, instead, they are required to complete the battering intervention program, which takes 18 weeks. And we have defined a curriculum because it is a psychosocial educational model to help them look at how they were influenced by culture, by society, by community and family to adopt behaviors that are actually harming their family and harming them, because many times they are very lonely. They have cut themselves off from the closest of potential relationships. And it doesn't excuse the choices that they've made, but it does help us to understand how they got where they are, but more importantly, for them to understand how they ended up being a person who is harming his family and who is taking actions that's actually destroying his inner being and his real family. Does that make sense what I'm saying? Okay. And so one of the things I also put in the chat is that we are encouraging people to look at that whole community model. I put one of the wheels in there that talks about the roles of different people in the community in confronting violence, and asking people to think about, who is your husband most likely to listen to? Is there a family member? Is there a religious advisor? Is it their boss? Is it a very dear friend who you could approach and say, I am very worried that these behaviors are getting more extreme, more dangerous, more difficult for the family, and we have to figure out how to get him to think about change and to think about stopping and heading in a different direction. You know, we believe in the United States that fully 40% of our divorces come from the use of violence. And if we want to avoid families that are just broken apart, we have to also confront the use of violence.
Thank you. Thank you so much.
So, excuse me.
So with regard to victims, what needs to be done and what has been done to help them step up and encourage them to seek help? And what steps have been taken in order to raise awareness to the whole community to stop domestic violence and help people talk about it? Sorry, it's like multifaceted type of question. So feel free to answer which part you would like, you are comfortable to talk about.
Well, if I may, it's a very interesting question. Actually, it is very interesting question actually. From DIFI perspective, from Doha Family Institute, what we don't provide a kind of a rehabilitation program, or we don't deal with the victims of domestic abuse. We deal with the family itself. But most likely we are focusing on the policy aspects, which impact the family well-being and protect them from any violent, or even to protect them and keep them happy within their life. So basically, I think this year we have started a programs called validate or establishing domestic violence tool or domestic abuse tool, in order, first of all, to measure the prevalence of domestic abuse here in Qatar. First of all, to have an accurate measures, and what form of abuse are predominantly manifest here in Qatar. The second part of that one, actually, based on the domestic abuse tool concept or philosophy, will be able to find also a protocol itself. So that protocol should be standardized across all the cabinet and crew members here in Qatar. For example, those who are working in hospitals, when they supposed to report the abuse, based on what, how they will be protected, and do they need to make sure that do they need to make a follow-up or not? And so those protocols has to be actually agreed across all corporate or institute working in Qatar. So that's what we are doing currently in Doha. And we currently look after I think what's mentioned by Afeya is regarding the post-divorce maintenance, regarding child custody issues, financial maintenance of the wife after divorce, and those aspects. Because what we know from the domestic violence is usually, even when the family broke up or divorced, the domestic abuse is still continue after that, especially if those have what they call children. So we need to ensure that they are actually getting their rights. They're entitled the financial entitlement. They have the visitation rights. Everything is well settled as per the law. But all these tactics are played, played by manipulator or the abuser themselves. So I guess going back to square one, I think some of the institute in Qatar, they have to focus more on raising the awareness level of the domestic abuse and what are the legal rights of the victims themselves, because they don't know even that's a kind of abuse. So that's it from our end, from my end.
Thank you, Khalid. Afeya, Debbie, would you like to comment on this question? Yes, so policy is, yeah, go ahead, please.
No, I was actually typing away in the chat. And so I wasn't listening as closely as I should have been to his remarks. But in terms of the larger question, I think that what we have to be able to do is help people feel more comfortable in being able to acknowledge that this is a widespread problem. I appreciate the research because a lot of times people like to say, oh, that doesn't happen here. It happens over in Mexico, or it happens over in some other place. It's not a problem for us, or it doesn't happen in our town. And yet in reality, it is everywhere, all around the world. I had a congressman ask me one time, isn't there some place in the world where this is not happening? And I said, sir, I've heard of a mythical island somewhere in the Pacific where no one is ever hurt by a family member, a neighbor, anyone. And if we can find that island and learn from them how they do it, wouldn't it be marvelous? And it took him a second to sort of realize that I was maybe trying to have a little fun in that moment. But, we all hope that there is some place where people have figured all this out. And we are slowly but surely doing that. As we learn from each other, as we try things and see what helps to really change beliefs, behavior, and the ways in which people work through issues, we'll get there.
Thank you. So you talked about the collaboration and the support. So what's required from the individuals, what's required from the members of the family, what's required from the community in order to help stop this, raise awareness about it? So there were lots of questions about educational programs at schools, involving youth in workshops, trainings, and get them to know about the reasons, the challenges, as well as the solutions. So there was a question also about the way we talk, or you talk as experts, you talk to survivors or women and children who are suffering from domestic violence. So the type of language that is used, there is specific type or like specific types of statements that shouldn't increase the pressure on the victims as much as try to relieve them and make them comfortable with whatever words that they hear. In fact, some of the participants, they already shared some of these. Yeah, so they are already there in the chat. So saying, I'm afraid for your safety. I'm afraid that it will escalate. I'm afraid for your children. It might get worse. And I'm here if you'd like someone to listen to you. And you don't deserve to be abused. You deserve a peaceful life, and all of these expressions. So going back to the support, whether it is psychological support, rehabilitation, or legal support. So what type of support is out there for survivors as well as victims. Go ahead, Anne. Please, go ahead.
اسمحي لي أن أجاوب على هالسؤال. طيب، راح أجاوب على السؤال السابق وأشبكه مع السؤال الثاني. السؤال السابق عندي إضافة فيه. مركز أمان والقائمين عليه كان عندهم رؤية أن لا يكون التدخل فقط عندما يكون العنف واقع. نحن نتدخل حتى عندما يكون العنف يعني إحساس، مجرد إحساس لدى الضحية أن هي قد تكون معرضة للعنف، يتم التدخل في هذه الشكوى أو في طلب الخدمة. ودليل على ذلك تصنيفات المركز الذي أعمل فيه، تصنيف عنف جسدي بأنواعه، وعنف جنسي، عنف نفسي، وأيضا في خانة اسمها عندنا معرض للعنف. هذه الخانة المعرض للعنف هي أكبر دليل على أن إحنا نستقبل حتى مجرد شعور الضحية بأنها معرضة للعنف، وهو إجراء وقائي قبل وقوع العنف نفسه. دائما نحن مؤمنين أن الوقاية خير من العلاج، فهذه جزء لازم احنا نذكره. يقوم به المركز والقائمين عليه مشكورين، وشهادتي مجروحة في المركز طبعا. السؤال الثاني، خلينا نقول ماذا يواجه المتعافين نقول من العنف أو التحديات التي تواجه ضحايا العنف. التحدي الذي يواجه ضحايا العنف هو الانتكاسة. بمعنى أنا كضحية عنف خدت قرار وبلغت عنه وتبعت خطوات ودخلت في خطة علاجية، ما أرجع ورا، خلاص أنا أكمل وأتابع. الجلسات التأهيلية هدفها أن نعطي وعي للضحية بالمؤشرات المبدئية قبل وقوع العنف مرة أخرى، ومهارات خلينا نقول فن طريقة الحوار نفسه، الديالوج نفسه يكون بين الرجل والمرأة، يكون فيه وعي حتى لا تكون أحيانا المرأة هي سبب في وقوع العنف على نفسها بأسلوبها في طريقة حوارها، أن تكون ذكية في التعامل، في اختيار الوقت المناسب في طرح موضوع، في أخذ قرارات في الأسرة. هذه فنيات تتعلمها عندنا الفئات المستهدفة في جلسات التأهيل. كذلك لا ننسى الشخص مرتكب العنف نفسه يأخذ جلسات في إدارة الغضب، هذا أنا ذكرته قبل وأرجع أقول الجلسات هذه جدا مهمة في إن إحنا نتأكد أن الضحية يعني فيما بعد لا تتعرض لانتكاسة ومن ثم تحدي بالتعرض للعنف مرة أخرى، قد يتسلل إليها اليأس. يعني في حالات ممكن تقول معنا أوكي مشينا في جلسات 3 شهور 9 شهور على حسب الحالة وخطورتها أو مدى أحيانا تكون حالات مركبة، وهذه من التحديات اللي احنا نواجهها عندما تكون الحالة مركبة، بمعنى أن يكون هناك في طرف مدمن في الأسرة، في سجل خلينا نقول جنائي معين. هذا تحدي كبير. يعني الفئات هذه أكثر اللي تواجه التحديات فيما بعد استفادة من خدمات المركز. وطبعا لا ننسى أن احنا ممكن حتى تتأخر إجراءاتها لأنها تكون مع جهات أخرى، يعني مثلا في مراكز علاج الإدمان، في محكمة الأسرة، في استشارات العائلية. فيعني هاي التحديات لازم نحن نتطرق لها، أن ممكن الحالة توصل تتعب يعني تاخذ البروسس نفسه يتعبها، فلازم احنا دائما نشحذ همتها ونعطيها أمل. يعني البرزنتيشن اللي أعطتها الأخت ديبي كان فيه خطوات وفي كلمات تحفيزية جميلة جدا، يعني هي يعني مأخوذة من الخدمة الاجتماعية. لا ننسى أن احنا تدخلنا الاجتماعي المهني يكون على أساس نظري وأساس مهني. الأساس النظري يكون بدراسة المشكلة، تحديد المشكلة ووضع حلول للمشكلة على حسب قوتها أو الأطراف المشتركة فيها. خلينا نقول استخدام نظريات الخدمة الاجتماعية في توعية الأطراف أو الضحية أو مرتكب العنف نفسه، لأن كل شخص له أبروتش معين أو تدخل معين بنظرية مختلفة في الخدمة الاجتماعية. هذا بالنسبة للتدخل النظري. يجي التدخل المهني يتمثل في جلسات يتمثل في خطة علاجية متعددة المحاور من قبل فريق متخصص متعدد التخصصات. فأتمنى أكون جاوبت له بشكل بريف يعني عن الموضوع. شكرا أسيل.
Thank you so much, Afeya. Honestly, the topic is of great interest. That's why we keep receiving lots of questions from the participants, and there is great interest to understand how things are going on in Qatar as well as in the US with regard to domestic violence. So for the sake of time, so we'll have this last question. So what if there is violence in the house itself, but it is against someone who's not a member of the family? Let's say that there are domestic workers. If they experience some type of domestic violence, do they have support, and what type of support is available to them? Because we have been talking about children, we have talking about partners in a family setting. So what if that person who is experiencing violence is outside the family? Do they have the same will they have the same support? Do they have to go the same channels to report it? So what is there in order to support them?
Well, I can answer for us in the United States right now, and then y'all can let us know more about what you're doing. But we went back into our laws and policies and changed a lot of things that said family member to say household member. And it was our way of communicating that anyone who was living in this household where a person was using violence needed to be supported and assisted, whether it was through legal aspects, or if it was counseling or other kinds of services, such as even for us, shelter, providing a place to go to get away from a person who's hurting you, even if it's a brief time. Shelter became available not only to family members, but to anyone living in that household, and including domestic workers. So that was our strategy of lifting it up and saying, this has to be also part of what we do. And we have a lot of people from many places in the world who come and live with families to provide domestic support in running the household and raising the children, whatever, and they deserve to be safe and respected.
Thank you.
Afeya, Asil, if you don't mind, just I would like to comment on your question.
Sure,
I don't know,
please,
Afeya, if you want to say something before, or shall I go ahead? Okay. Well, I think regarding the domestic workers. Okay, thank you very much. Regarding the domestic workers, yeah, I will share with you our experience from DIFI. When actually I came up with the notion of establishing a domestic abuse tool, we have included a new tool which can actually measure the domestic abuse against the domestic worker. So that's what we propose from DIFI, and we are currently working on that. And recently, actually, I think with a couple of days, we will send an official letter to collaborate with Aman on that. However, regarding the domestic workers, I think they are well protected by the law itself here in Qatar, because they can report it directly to authorities and they will be fully protected. I know one thing regarding women, if their rights has been violated and they are working as a domestic workers in the house, they will be transferred to Aman. They have a kind of shelters, because I think 5 to 6 years ago, I have visited that shelters myself, and I've seen a lot of people, they are staying together, and most of them, they are Qataris and non-Qataris, a mixture of everyone. I think, accessing to the help for domestic workers are much more easier than the family members themselves, because here we don't think for the family members, there are different calculations. They will think about, not breaking up this union of the family. But for domestic workers, of course, he have an employment agreement and he has his own right to preserve. So just he needs to notify the authorities, and then the official authorities will intervene to resolve this conflict, which mainly protected by the law itself, by criminal law, if I'm not mistaken.
Thank you, Khalid.
Thank you.
Afeya?
كما ذكرت سابقا خدمات المركز هي مجانية وتشمل جميع من هم على أرض الدولة من مواطنين ومقيمين بجميع شرائح وفئاتهم، ونركز هنا على العاملين في المنزل يتمتعون بكافة الحقوق والخدمات، يعني هم مستفيدين كذلك من الخدمات الموجودة في المركز حالهم حال أي مواطن. والقائمين على المركز عملوا على توفير من بداية من الخط الساخن حتى إدارة الحالات، حتى الأخصائيين الاجتماعيات والفريق العلاجي أن يكونوا متحدثين بأكثر من لغة، حرصاً على تقديم هذه الخدمة للجميع، ووجود مترجمين كذلك في حال وجود لغات أخرى صعبة قد تكون غير متداولة بكثرة لدينا، من ضمنها الأردو واللغة الفرنسية والبشتو وإلى ذلك. فبالعكس لا يوجد هناك فرق بين أن تكون أنت من أفراد الأسرة الأساسيين أو تكون عامل لدى الأسرة، الجميع لهم نفس الخدمات بنفس المستوى بنفس الجودة. شكرا.
Thank you so much, Afeya. So as you all mentioned, it's a process. It requires the contribution of everyone. So it's not just the victim, it's not just the perpetrator. So everyone, all the members of the community, we all have the responsibility in order to have a community that is free of all domestic violence, inshallah, one day, hopefully everywhere. And as Debbie put it, there is an island that no one knows. There is no island. There might be an island somewhere that there is no domestic violence, but it's our responsibility. And as you all noted, we need to monitor what's going on around us and around our beloved ones. We need to identify any acts that refer to domestic violence, because people might be really in danger and we are not aware of that. We need also to interfere whenever is needed, even if it is consultation, if it is a piece of advice, and we need to protect those people that really need the protection. So it's a call to everyone to take part in this, as well as educational programs that are needed in the community, in schools, young people, to let them aware and help them get aware of all the services that are provided, as well as the help that they can provide to each other, as well as to the community in general. So it's our discussion, but it's the last thing. So in the future, we need to meet and discuss, because this is really a very important topic. So now we will have the closing remarks, concluding remarks by Sarita Glassburner-Mion, Acting Consular Officer at U.S. Embassy, Doha.
Hello. On behalf of the U.S. Embassy here in Qatar, I would like to thank our panelists, Debbie Tucker, Dr. Khalid, and Ms. Afeya, for your presentations. Thank you so much to everybody, including our audience, for participating today. We understand that today's discussion is a topic that is incredibly challenging, but these exchanges give voice to a lot of people in our society who do not have a voice. Here at the U.S. Embassy, I'm the acting consular chief, and my top priority is the safety and security of U.S. citizens that are present in Qatar. Before I joined the Foreign Service, I was a prosecutor who specialized in domestic violence. So this issue is incredibly important to me personally and professionally. In fact, in homes where violence between partners occurs, there is a 45 to 60% chance of co-occurring child abuse, and children witness 68 to 80% of domestic assaults. While this is an issue particularly important to women, it is a society-wide challenge. Here in Qatar, the Doha Family Institute and the Aman Center are providing tools and outreach, which is incredibly important to families. We thank them for their critical work. I'm also thankful for experts like Deborah Tucker, who's been here today to share her incredible years of experience in an effort to eradicate domestic violence, hold offenders accountable, and support victims and survivors. This month is Women's History Month, As we celebrate women's achievements, we must also recognize the barriers that so many continue to face, as well as all of the challenges they confront, including violence in their close relationships. This discussion cannot end today or this month. It should be a starting point for dialogue between our countries, sharing resources and ways we can come together to prevent domestic violence and to support survivors. Thank you all so much. Thank you for being here this afternoon.
Thank you so much. Thanks a lot, Sarika. Thanks a lot to our panelists, to participants today. It's really great honor to talk to all of you, and hopefully we can meet in the future in more discussions. So take care, and thanks a lot for all the questions that were raised, all the discussions. Thanks, and hope to meet with you in future sessions. Thanks a lot.
Thank you very much. Thanks.
Thanks.